We are just 5 days away from a government shutdown. If Congress doesn't pass a bill by next Tuesday, September 30, the services that millions of Americans rely on will close. As a member of the Appropriations Committee, actually Adam used to be on that same committee, and I am now, I have a front row seat. You know, all those years as appropriators, well, you guys actually appropriated stuff. Now it's a tougher situation. We're supposed to write the bills that fund the government. That's how it's supposed to work, on a bipartisan basis. And we see firsthand what's at stake with government funding for families, for healthcare providers, for everyone who depends on federal services. But where we find ourselves today really is without precedent. Last week, House Republicans forced a vote on a purely partisan funding bill that drives up healthcare costs, does nothing to protect families from skyrocketing premiums. We're going to talk about the Affordable Care Act, but it's not just about the Affordable Care Act. Anybody that has healthcare in the United States will see their premiums go up as a result of what the Republicans want to do. With regard to the ACA, those tax credits are set to expire at the end of this year. And if that happens, 660,000 Californians will lose their health insurance altogether because it'll simply be too expensive for them to renew. That's roughly 5 million people across the country. Think of that, 660,000 in California that will lose their coverage under Covered California, 5 million across the country. Not to mention, those who stay on Covered California will see their premiums go up, in many cases very significantly. That means parents paying hundreds more a month just to take their kids to the doctor, means families having to choose in some cases between healthcare and groceries. These cuts would hit places like TrueCare very, very hard. That's why we wanted to be here today. But it's not just TRICARE. Anywhere you get your healthcare in San Diego, these cuts will impact you and your family. If you're on the ACA, if you're on Medicare, if you have private insurance, if you have employer-sponsored insurance, these cuts and these premium increases will impact you. So I would not stand for that, and I will not stand for that. And I'm one of those that voted against the partisan funding bill. I'm grateful to my friends in the Senate because it passed in the House on a purely party line vote, but it requires 60 in the Senate. The Senate held firm and voted no. Here's the hypocrisy, and I wanted to share something with you. President Obama had to deal with a shutdown in 2013. And at the time, citizen Donald Trump said, and I quote, "Problems start from the top and they have to get solved from the top." He said, quote, "The president is the leader and he's got to get everybody in a room and he's got to lead." He said that on Fox and Friends, by the way. And he continued, "I really think the pressure is on the president," end quote. He really said all that stuff. We posted the video of it this morning. Today as president, he's doing the exact opposite. You probably know that he had actually agreed to a meeting with Democratic leadership, with Chuck Schumer and with Hakeem Jeffries. That meeting was supposed to happen earlier today, 3 o'clock Eastern time today, Thursday. But then he pulled the plug. He pulled the plug after John Thune and Mike Johnson told him to pull the plug. At least that's how it's been reported. So the president refuses to meet. The president refuses to negotiate. The president refuses to solve anything at all. That is the opposite of leadership. And this whole situation, as far as I'm concerned, is on him and is on the Republican leaders of Congress who empower him regardless of the cost. To make matters worse, the budget director, Russ Vought, more and more people are hearing about Russ Vought these days. He was a key architect of Project 2025. He told federal agencies in a memo that came out this morning that if there was a shutdown, that they should just fire workers. They should just have a wide-scale reduction in force and shut down programs that Congress already approved. That is blatantly unconstitutional. It is blatantly illegal, and we will not be intimidated by that sort of threat. Shutdowns do cause temporary furloughs. That is true. But they cannot be used to fire career civil servants or to erase programs that remain the law of the land. Courts are going to reverse it, and taxpayers, unfortunately, will end up paying even more when those folks are rehired with back pay. So let's be clear again. Republicans control the House. Republicans control the Senate. We all know Donald Trump is in the White House. If the government shuts down, it's because they wanted it to shut down. It is because they refuse to negotiate in good faith with any of us. This is on them. The bottom line for me is this. We've got to lower costs for families. We've got to protect access to care, and we've got to stop this breakdown of the American healthcare system that we are seeing in real time. I'm ready to return to Washington right now. I think we would both get on a flight right now if it meant we could go negotiate in good faith to try to get a bipartisan spending deal across the line to prevent a shutdown and to protect the services that San Diego families depend on. And while I'll keep working in good faith, I will not compromise health care for my constituents. Not now, not ever.